second. For whatever reason, my computer is not loading Zoom for me. All right, give me a couple seconds. I'm trying to troubleshoot this computer. It's not loading my Zoom for me. All right, I got it working. All right, if you can go ahead and put your name in the chat for me. All right. All right. Can everybody hear me? All right. So this week, our objective was to read over chapter 2. Of course, we had some discussion questions about, what organization we were potentially interested in the future. And of course, we had our typical homework assignment, which was usually terms and end of chapter questions. And I don't remember what the homework assignment was for this week. So, all right. So the objectives for this chapter, many objectives, differentiate accreditation from certification and representation functions of the various professional organizations. Also describe the organizations that carry out the professional aspects of a specific radiologic and imaging science area of specialization. And then also describe the relationship of various radiologists and physicist organizations with radiologic and imaging sciences. All right, so I'm going to go ahead and make your first ICA available. You will find it in, get out of here. Let me do it from my phone. You're going to find it in Module 2. Do it from here. All right, it should be available in Module 2. All right, what you're going to be doing tonight for your ICA is, first of all, the title is going to be Professional Organizations. And then you're going to type or write 1219-612. That is your header. All right, so those were your objectives. Everybody got their header? Okay.
It was Professional Organizations 1219-612.
Yes.
Okay.
All right. So moving on. All right, so the first thing that we're going to talk about is what we consider general classifications of ensuring quality. So it gives us four categories here, and those categories are accreditation, certification, licensure, and then also professional organizations. So the first one, accreditation. So this is basically how you know that your school is recognized. So a big one for us is, I'll say, it can be a school accreditor, like our school is accredited by an organization called ABHES, or it can be a programmatic accreditation as well. So your X-ray program could also be accredited, and the main accreditor for X-ray programs in the United States is JCERT, JRCERT. They're actually the only accreditor for X-ray programs. All right, but you don't have your program doesn't have to be accredited via JCERT for you to be able to sit for the boards. If your school accreditation is recognized by ARRT, you are eligible to sit for your boards, your registry once you complete the program. All right, so the next one is certification. All right, so certification, when you finish X-ray school, you are going to be allowed to sit for your boards with what organization? Anybody? Based on your readings, what organization? Nobody?
Is it
ART.
ARRT?
Correct. ARRT.
ART, yeah.
Yes, American Registry of Radiologic Technologists. So once you graduate and we deem you ready to sit for your boards, you will apply to the ARRT. Of course, they're going to ask you about your background, whether you have any type of offenses such as felonies or misdemeanors. They will require you to pay a fee, and ANU will pay for your first attempt. Currently, that is $225. You only get 3 opportunities to pass your boards with the ARRT. The second and third attempt, should you need those, they're currently $200 each. And should you not pass any of the attempts in order to get more attempts, unfortunately, you would need to go all the way back through another tech producing school. The other, I'll say, stipulation with the 3 attempts, you have 3 years post-graduation to complete those attempts if you needed more than one or two. If you allow that 3-year window to lapse, anything that remains would expire. And unfortunately, again, we're back at the same point. To get more attempts, you have to go all the way back through another tech producing school. All right, the next one is licensure. So with the licensure, that kind of goes hand in hand with certification sometimes. Some states require an additional licensure. I live in the state of Georgia. We don't have a licensing body, but I will show you all for you all that live in different states. We'll go to that website tonight to figure out who your licensing body is for your state and whether or not you are required to have a licensure. Sometimes the state will allow you to work with just your ARRT certification. Some states don't have any requirements, and some states want both your ARRT and state certification. And then some states, you just need their state licensure, or not certification, but licensure. All right, and the last one that you see on the list there are your professional organizations. So these organizations, of course, are voluntary. You don't have to join the organization. A little bit different from ARRT because that's a licensing body. The professional organizations are bodies that you can apply to, like American Society of Radiologic Technologists and many others. They are voluntary, but certification is voluntary too. But in some states, if you're not certified and you're not licensed, you're not going to be able to work. Depending on the professional organization, they do have many benefits or offerings for ASRT. One of the benefits for some technologists, once they are certified with ART, they do allow us the opportunity to get our CEUs through them. You can also go to conferences, stay up to date with what's going on in the X-ray world. And then also for students, if you were to join, they have study resources, they have SEAL exams that you can take. Some are free, but some you do have to pay for additional ones. And they also allow for scholarship opportunities and leadership opportunities for students as well. All right, so those are the general classifications that we typically consult or used to ensure the quality of your program or the quality of your school. All right, so next is accreditation. So we're looking at each of these individually now. So accreditation, it is a process that ensures that you have, or the program or the school that you are in, they have high quality of operation and offerings in terms of their standards. Again, accreditation is voluntary, so you could have chosen a school that was not accredited. And sometimes when you choose a school that is not accredited, when you get to the end, you might find that you're not going to be able to sit for your board. So it is important for you to do your research on your school and your program. It is a voluntary peer process, and it does involve several areas within healthcare, such as, some hospitals are accredited. Their main accreditors like JCO, DMV. So there's several. All right, so that is what accreditation is. So when your accrediting body, because they do visit the schools, your school is accredited for a period of time, 3, 5, and I think 8 years, depending on the accreditor. At the end of the year of accreditation, they come back to another visit and they have a checklist of things that they go through, the individual departments of the school to include your program to ensure that you are functioning in the capacity that you stated that you would function in. Yes. Sorry, I'm trying to move some of these windows around.
I have a quick question, Dr.
Yes.
Are we taking handwritten notes for this?
Yes.
Okay. Okay.
All right. When we started, the header was professional organizations, and behind professional organizations, I think we said 1219 612 maybe. Is that what we said?
Yeah.
Okay. Yeah, they're handwritten, and these will be uploaded as your ICA along with the other things. Once we get to the websites, we'll take notes on those as well. All right, the last bullet point right here, the standards are set by the organization that sponsors the accrediting agency. So when they come to the school for the visit, they go through the standards to make sure that we're abiding by those standards. And it is very highly valued by members of the profession. So some, let's say, employers, they look to see that you went to, or they ask in the job announcement, for graduates that graduated from, let's say, a JCERT accredited program, or for graduates that have graduated from an accredited program, not necessarily JCERT or an accredited school. All right, so it is valued because the members think that if you go through a program that is accredited, that you will have gotten all of the information that you need to be successful in the field. All right, moving on to the next one. Next is accreditation of schools. All right, so we have a few listed here, and of course, they are based on the type of program that you're going through. So not only is your school accredited regionally or institutionally, sometimes the program within the school, meaning your X-ray program, can be accredited as well. So if you're going through an X-ray program or a nuclear medicine type program, the big accreditor here in the US is JCERT. And the only accreditor for X-ray is JCERT, also radiation therapy as well. For sonography, they're looking for JRC DMS and also KHEP accreditation is a big one. For Nuke Med, here's another one that they can be accredited by. And of course, if we're talking about interventional or cardiovascular technology, this bottom one is the accreditor or the main programmatic accreditor that they are looking for. So not to say that if your program is not accredited, you cannot sit for your boards, but you do need to have some type of accreditation on your school, whether it's regional accreditor like SACS or whether it's an institutional accreditor like ABHES. All right, so the first programmatic accreditor or the main one for X-ray is JCERT. So as it states right here, JCERT is concerned with compliance and education standards, and it's developed by and for the profession of radiologic technology. Also, like I stated, they accredit JCERT accredits nuclear medicine programs, and I think they also accredit radiation therapy programs as well. Governed by the Joint Review Committee or JRC. So there's a board of directors that look at all of the information and citations from different programs, if there are any, or they renew your accreditation once it expires, if you, of course, were in compliance. And they do require that you demonstrate compliance with the minimum requirements, and these requirements as are known as the essentials and guidelines or standards. Now, while your program is not JCERT accredited, ABHES does follow the JCERT standard. So I am a ABHES evaluator. So we go around to different programs or schools and we look at the program as far as are they meeting the standards. Now I can't go to any schools that I work for, nor can I go visit any schools that are in the state that I live. It's kind of like a conflict of interest. But we can get called up to visit other schools in other states to look at their X-ray programs, to talk to their instructors and their deans or chairs, also to talk to their students. And then the last people that we go and talk to, we go to the clinical sites to make sure that the clinical sites feel supported and that the students are getting what they need as well. All right, just a little bit of history about JCERT. It was established in 1969. If you're interested in going to their website, that is the link for it. Some things that you see when you go on JCERT, you can find a map. So you say, hey, I'm interested in going to X-ray school. I want to go to X-ray school in this state, and it will pull up all of the JCERT accredited programs in that state. What you can find on the website when you go to the different schools, because it will hyperlink you to that school, you can find what clinical sites they have. You can find what their outcomes are in terms of placement, in terms of retention, and also when I say placement, employment, and then in terms of registry pass rates. Depending on the accreditor, for instance, ABHES, our outcomes are at 70%. That's dictated and determined by ABHES. It says that we must retain 70% of our students that enter, 70% of our students that sit for their boards must pass, and also 70% of the students, when they graduate, they must be employed. So it is really important as the student and not only as the school that we're ensuring that our students are getting or doing what they need to be to be successful on their registry or to get a job after they graduate, and also to remain in the program as well. All right, board members typically are nominated by the profession. And of course, the board members are within the profession as well. So they're subject matter experts. They currently accredit, JCERT currently accredits X-ray programs, radiation therapy programs, medical dosimetry. So that's kind of a branch of radiation therapy. So where radiation therapists, they treat the patients, dosimetrists plan the treatment for the patients. And they were typically, sometimes in most cases, former radiation therapists. And another program that they accredit are MRI programs as well. Now, I know some of you are interested in sonography as well as some of the other, I'll say, modalities. Again, going back to the first page, their big accreditor we'll get to next is JRC DMS. All right, so JRC DMS, just like JCERT, they're concerned with compliance, ensuring that your school is meeting all of the standards that they have for that profession. Medical sonography, of course, that's ultrasound. Established in 1983, currently accredits approximately 200 institutions that deal with ultrasound. So just like if you were interested in finding a school that is accredited in terms of sonography, you'll go to the JRC DMS website. You can also look at CAHEP as well. That's another big one, and find the school within the state that you're interested in, as well as their outcomes as well. All right, the next one, if you're interested in going to nuclear medicine school after you pass your boards, JRC NMT is the accreditor for nuclear medical schools or nuclear medicine schools. Established in 1970, accredits 70 or more nuclear medicine programs. And again, you could go to their website to find a school, to look at the outcomes of that school, to look at, the clinical sites potentially that site has, that school has as well. And also, sometimes you might be able to find reviews as well to see if it's going to be a good fit for you or not. And you'll be able to look at what the requirements are to get into that program as well. All right, now we're moving into here's another accreditor if you're interested in interventional or cardiovascular imaging. Here's another accreditor. Again, you can go to the different websites and figure out what type of requirements you need to get into those schools. All right, but accreditation is one thing that you are looking for. Nothing like going through 2 years. And I was a student that did this. I went through school for public health, finished the program. Was it a master's degree? It was a master's degree, and found out that not only was the program not accredited, but also you want to do your research to see what type of people are they interested in hiring. So most public health professionals, they're looking to hire nurses that graduated from accredited program. So you have to make sure you do your research. All right, now we're moving on to certification. So certification tells the employer that you have if you've earned your certification, it tells your employer that you have or have demonstrated the minimum requirements to be a professional entry level worker. All right, generally you have to have some type of, it's competency based. So for you all, in addition to passing and getting all those comps in clinic, you also need to sit for an exam. It is voluntary. It's not required that you go apply to the ART once you graduate school. But if that is, hopefully that is a goal for all of you. Once you graduate, you want to be ready to sit for your boards. For all of you that are interested in going to those additional modalities, this is your first, I'll say, hurdle, all right, to pass your national registry with the ARRT. But again, it is voluntary. You don't have to sit, but hopefully you do want to sit. And we do call it the registry. Once you pass or once you graduate, you go apply, sit for your registry, pass, and then your name goes in the registry. So any employer could now, if you say you're applying for a job, you say, I am registered, they can go and look your name up in the registry to see if you are in fact registered with the ART. Now you can say to the ART, hey, I don't want my name listed in there. But it's kind of, I don't know. I wouldn't do it because someone can easily go and verify that I am registered if I'm looking for a job. If I went in and I was interviewing someone and I could not find their name in there outside of them maybe having a name change, I would be, curious to know why you did not want to be listed in there. All right, it is your responsibility once you are registered to make sure that you maintain your registry. So every year, the month of your birth date, so the last month, so for instance, let's say my birthday was in April. The last day in February, I need, March. The last day in March, I need to have paid the money. And if it's a year where I need to give CEUs, my 24 CEUs, I need to have those uploaded so that they can renew my certification with the ARRT. Um, so where the last bullet point where it says professional certification is a requirement for employment in most healthcare institutions. At one point, it was really difficult to get a job at a hospital if you were not registered. But now what I'm seeing is because of the shortage, there are some hospitals that are willing to hire registry eligible graduates, but in most cases, they give them a deadline of when they need to be registered. In Georgia, I will say that all of the hospitals are looking for you to be registered at some point. Again, they may give you a few months or even up to a year to become registered. Now, some of your outpatients, one of our big outpatient like ortho place is Resurgence. You don't have to be registered to work there. Some of our travel agencies here in Georgia, you don't have to be registered. But again, if you're not registered, then you have a ceiling, meaning unless you know someone that's willing to give you the opportunity to work in one of those modalities and are willing to train you on the job because you can't go to school for it, you're not going to be able to go into those modalities. Also, in my opinion, if you're not registered and I'm the employer, I might be looking to pay you less than those technologists that are actually registered. So again, prior to COVID and prior to, I'll say most of the baby boomers are retiring right now. Now that there's a shortage, some organizations or hospitals are willing to give you a chance, especially if you did your clinicals there and you were very good at what you did there. They're willing to give you a chance and give you some time to study to to get your registry. So when I say registry eligible, that means that you still have 1, 2, or 3 opportunities left to pass your boards and your window has not closed on you. All right, certification, again, it's awarded at the individual level. So all of you, when you graduate, you will individually apply to the ARRT and you will individually on your own go sit for your boards, not a group effort. Certifications are offered in different modalities. So you're here for this RTR. So when you graduate and you go sit for your boards, let's say you pass your credentials. Let me see if I can write on this. So for instance, my name is whatever my name is. Typically, if you have a degree, it would go behind the name. So for instance, let's say I have my bachelor's degree. We typically don't list associates, but I guess it wouldn't be wrong if you wanted to list your associates. Then the next letters that come behind your name are RT, and then whatever that credential is would go behind the RT. Some people also go ahead and so it'd be my first name, last name, um, my degree level, the highest one that you've achieved, RT, R, and then some people go ahead and write ARRT behind it so that they know that you were licensed by ARRT. So let's say I've achieved that one, but now I want to go to Mammo School, which is not listed here. I graduate Mammo School or did the on-the-job training to get my competencies. I finished up the didactic portion, which is required, but it can be done online. And I've sat for my boards and now I've passed. So now I am going to add an additional letter to my name. And then whoever that credentialing body is. All right, and these letters are limitless. The only barrier is you need to go back to school for it, but it can be online, it can be in person. Um, if you're a good what do you call it? If you're good working alone and learning the information on your own, like doing things virtually, then you can do it online with the ARRT. You can sit for your boards, but you do have to get the clinical checkoff. So you have to find a place that's willing to host you to get your checkoffs. This one right here is like a PA, but only for imaging. If you are interested in being a radiologist assistant, this is one that I would say you definitely need to do your research on. You need to look at the job market for it. So look at, let's say go to Indeed and look for radiologist assistant jobs. And then also see what the outlook is. At one point in time, the radiologist assistants, they were finding it difficult to find work in this field because of some of the Medicare and Medicaid laws that change. If your exam, let's say you're going in for fluoro, if that exam was not performed by a radiologist, then sometimes the facility was having problems getting paid for that exam. All right, the insurance company did not want to pay. So again, probably a really good field, but just look at the job market before you jump into this one. This is more like a master's level program. A lot of these guys at one point, they were going back, they were falling back, even though they had this credential, they were falling back to jobs that were more interventional, like whether it's vascular or whether it was cardio. And I don't see cardio listed here, CBT. All right, but again, these initials, this train of initials behind your name, once you get the initial one, the primary credential, you can get as many post-primary credentials as you want. All right, any questions so far? Second. Mhm. All right, moving on. And this is kind of what I pointed out to you or drew on the board for you. Once you become certified, it is national. There, we can find proof that you do or you are certified. It does, in most cases, for all of them, require some type of ongoing continuing education. If you don't get your CEUs, you do go on probation, and then they make you give them more than you initially needed to, kind of like a penalty. And if you still don't get them in the time period allotted, you can lose your credential. It does provide you with the privilege of displaying these letters behind your name. All right. In fact, if you get caught misrepresenting yourself, there you can be sued actually. All right. And of course, our creditor is ARRT. All right, popular certification agencies. So these are popular in terms of these are the ones that I'll say employers are looking for. So ARRT for us, as well as radiation therapy, nuclear medicine, and all of those other ones that you saw listed, all of those other credentials. The most popular one, even though we do have a sonography credential, let me pack up for you. Um, right here, even though there is a credential under ARRT, this is not like the main accreditor. Most jobs are looking for ARDMS, and they're looking for you to have a graduate, to be a graduate from a KHEP accredited program. And of course, nuclear med, this is their who holds their certification board. If you go to these websites, you will be able to research what the requirements are. So we'll do that tonight. Also, how many CEUs, you'll be able to research what the registry, the board test is all about, how many questions, how much time you get. You can look at the sanctions list, meaning people that once were credentialed, maybe they got in trouble in their own probation or they lost their credential altogether. All of that you can find on the websites. But the one that we're going to be interested in is ARRT. All right, state licensing agencies, depending on your state, in addition to the national registry with the ARRT, if it is a requirement of your state, some states do also have licensure as well. So meaning you cannot work in even though you have your national registry, you cannot work in that state unless you get their state licensure. All right, and as it says right here, laws vary from state to state. Some states have licensure requirements, some states don't, and it is your responsibility to figure out, especially let's say you live in Georgia, but now I'm interested in moving to Texas. It's my responsibility to figure out if Texas has a licensure requirement, and it's my responsibility if I want to work in that job to get that licensure. So one of the ways that you can figure out really quickly is if your state has a licensure is sometimes to look at the job announcement. But I will show you on the ASRT website where you can look up, let's say, oh, I'm interested in going to this state. You could look at the job announcement or you could go to the ASRT website, figure out who the licensing body is for that state, and then go to that website to fill out your application and figure out what you need to do to get the licensure. Some is just an exchange of money after you've passed your boards with the ART. Some it's an exchange of money after you show them that you have X amount of education. And then some do require you to actually take a test. Like it's stated, most states do recognize ARRT, so they might just give you, let you exchange the money for the licensure. And some states like Texas, they have an actual test that you need to take in addition to sometimes your ARRT. All right, professional society. So this is, I believe, one of the discussion questions. We asked, what professional society were you interested in joining? All right, professional societies represent the general welfare of the members. So, a big one for us is ASRT, American Society of Radiologic Technologists. Not only do they represent us. They also provide us with education opportunities via publication. So let's say you join. They used to send magazines out, but now the magazines are online. They may send a couple publications to you. You can go to conferences to get your CEUs, to network, to learn new things. And there are also online sessions as well or online education. So for instance, ASRT, you can purchase, let's say, a course. I'm interested in CT. I want to purchase an online course. I'm going to go through that course to get the didactic um, requirements to sit for the boards, but then I have to find my own clinical placement and, of course, get those competency checkoffs that I need. Some of these organizations or societies have scholarships. They have research opportunities or also research scholarships as well. They do represent us in the government. And when I say represent us in the government, some of these societies, each state usually has their own as well. So for instance, for Georgia, it's GSRT. So they petition every year to pretty much, well, not every year, I would say, but they're the ones that are petitioning to say, hey, we don't think it's fair that, you can work in the state of Georgia without being nationally registered. We would like for you to have a state requirement. So that's kind of how they represent us. They also dibble and dabble in malpractice insurance plans, and also they market for us and they kind of put it out there to the public who we are and what we represent. So I can't remember what the campaign was this year. I think Kaleidoscope of something, but we'll take a look at that as well. One year it was something about us being seen, making the public more aware of who we are. All right, so here are some of the organizations that you had the opportunity to look over in your book. It gave you the organization. It talked a little bit about what the organization was. And then, of course, you decide whether or not you want to join. If you want to join, of course, you apply, you exchange money, and of course, they have to accept you. All right, so AHRA, that's one that a lot of, I'll say, people that are in management in imaging join. ASRT, pretty much everyone in the imaging world, to include students, normally join that one. Another big one is heirs, educators typically join heirs to, see, network and stay familiar with what's going on in the field. But, your book kind of described all of them or some of them. And there's also some state organizations. So your state might have an organization. So again, Georgia is GSRT, so Georgia Society of Radiologic Technology. South Carolina, I was a part of that one. I think it was SCRT. And then what other state have I lived in? North Carolina. All states probably have their local branch, just like ASRT. All right, so technologist organizations. All right, here are radiologists and physicist organizations. However, sometimes technologists can join them. A big one that I know for sure that technologists can join are RSNA and Astro. All right, but a lot of radiologists and health physicists also join these organizations as well. But they're not limited. They're not limited. They can also join these if they were interested, but these are their big ones over here. All right, so any questions about what this chapter was all about? All right, so your first task is you're going to go ahead and take those notes that you took. you're gonna use some type of app, or maybe you can even at this point, you can take a picture. I need for you to upload it to the ICA. That is your first task for the ICA. All right. Once we finish out the lesson, as we're visiting these websites, your goal is to add to your notes. So as we're going through the websites, I need for you to, let's say the first one we're going to look at is ARRT. Just write down some points or a brief summary of what we discussed for ARRT. All right, so go ahead and load those notes for me in your ICA. It should be in module 2. All right, if your camera is not on when we go on our break, go ahead and try to troubleshoot it because your camera must be on. You can also, if your computer is not working, sometimes you can log on with your phone as well, additionally, so that your camera is on. Your instructors do have the ability to disconnect you if your camera is not on. All right, once you load those, I'm gonna go ahead and put you on a 10-minute break. And when you come back, we will go through some of the websites and I can point out some of the important stuff from the websites that you should be aware of and potentially go back and do some further research as you're still in X-ray school. All right, so we'll come back at 7:06. 7:06.
So when we take a picture of the assignment, we submit the assignment on the ICA and the module 2 immediately.
Yes, ma'am.
Okay,
Submitted it immediately. That just tells me that's my note to self that, hey, I'm not sure who was talking. Who was talking?
that was
Zainab.
me. That was me.
You were present for at least the first portion of the lecture,
Okay,
and then typically your instructors will have a second assignment, or some have you type your name in the chat again because you don't get to submit your ICA if you weren't present for class or the majority of class. You don't get credit for it.
gotcha. Thank you.
Mhm. Mhm. All right, so everybody should be back now. So we're going to start off with the ART. All right, so the ARRT is important for you because this is who you're going to apply to take your boards. All right, so at the top of the page, you can see the about. You can look at, they have a job board, they have volunteer opportunities. As we stated earlier, government affairs, research, news and events. You can read that on your own. The next section is, I'll say, as a employer, this section is important for us right here. We can go to verify your credentials. So say I have an employee, and I'm interested to see if they're actually registered on probation, etc. I can just type in their name. And it will show whether or not they're registered. Now, some people do have like the same names. So then you have to go potentially by city. And then you can look at their details to see when their biennium is, meaning the next time that I need to submit CEUs or next time I need to submit CEUs will be in 2027. Um, and I am valid through, or my licensure is valid through May of the upcoming year. Once April of the upcoming year gets here, I need to pay my money again so that I will be valid until May 2027. Once April 2027 gets here, then I need to submit my 24 CEUs to remain compliant. Now, it also says here CQR compliance. Since I took my registry so long ago, I do not have to take the CQR test. But you all, once you get registered, you will have to take this CQR test every 10 years once you get registered. Now, again, it is a test. I do think you have to pay for it now, but if you don't pass, they don't take your registry away from you. I mean, they don't take your licensure away from you. But from what I hear, they give you some additional research or information that you should look into. All right, so this is how I can determine if my employees are current. They used to send us paper cards in the mail, but now to get your verification and for you to get your verification to send, we all have to go through this website. So again, request verification on ART letterhead. This is what you can do, but some employers do accept you just going to log into your actual credential and printing it out yourself because you'll get a login. All right, the next thing that I feel is important for you all, well, not necessarily important, but something that we can look at is the sanction list. All right, kind of like the blotter almost. So the sanction list lists everyone in the state and the date of the sanction and the type of sanction that they received um, for whatever offense they had. So as you can see right here, this person was reprimanded for whatever offense that was reported to ARRT. this person's or these persons' licensure was revoked. All right, these people now they are ineligible for their registry, I mean for their licensure. And this one a settlement agreement was reached. Sometimes when you talk about settlement agreements, meaning they might have been using that credential behind their name without permission in terms of the fact that they were not registered, or maybe they were on probation or something of that nature. So we talked a little bit about the standards of ethics. All right, so this is what was violated to get on this list. And depending on how egregious it was, some of it led to the licensure being revoked, and some of it led to the licensure, them no longer being eligible. Um, how do you have to pay? How do you have to pay? You pay online. So you pay online once you probably about maybe a few months before yours is about to expire, you can log in and it'll tell you whether or not, let me see if I can log in. It'll tell you whether or not you're eligible to pay it at that time. It'll ask you some questions and then you go from there. I'll see if I can log in. All right, the definitions right here when it talks about ineligible, revoked, etc. This is where you'll get your definitions from. All right, so if you wanted to know, oh, well, what does that really mean that they were reprimanded? Or what does that mean that it was revoked? This is where you get your definitions from. And we didn't see, well, we did see this one, settlement agreement. Again, misrepresentation or continued misrepresentation that you are actually licensed. So to avoid legal action, meaning them going to court to try and sue you, they reach some type of settlement agreement. All right, so let me see if I can log in. All right, so when you do get your account, you will be able to log in. It tells you a little bit about your credentials. Then it tells you your deadline. So by between March 1st of next year and May 31st of next year, I need to pay them the money to renew. Um, Kind of like when you your license tags on your car annually that you got to go renew it. That's kind of what this is. All right, renewal fees, they are going up. Right now, it was $30 for your first discipline if you were, let's say, just RTR. If you have any additional ones that you want to keep, you have to pay them $15 each. So if I was Mammo, I would have had to pay $45 and then an additional $15 for every other one I have. Um, for the sonography credential, that one was $45. All right, so for new 2026, oh my goodness, they're doubling plus $5 the cost of the registry. So they're doubling this. There's probably going to potentially be an increase in sitting for your boards as well pretty soon. All right, so the next time I renew in January, I have to pay $65. Oh, and the $65, but that's cool, I guess, for those that have more than one credential because they don't have to pay that additional fee. But when you have just one credential, it's still $65. All right, again, how do you renew? You go on. Once you're eligible, once it's time for you to renew, it'll pop up in here somewhere on the side for you to go ahead and start your renewal process, but it won't pop up until we reach that March 1st date. By biennium, so CEUs by 2027, so the end of April 2027, I need to submit my 24 continuing education credits. However you decided to get them. One thing that I've done in the past, if you go to school, depending on what you go to school for, in some cases, one college course kind of foots the bill for the CEUs. So it just depends on what they're willing to take. So I wouldn't wait until the last minute because they may reject something. But again, you can submit a college class. Let's say you did you went on and got your bachelor's degree in radiologic sciences. One of those classes within that curriculum, you could submit and potentially get all of the CEUs, or you can do individual classes or CEUs as well. All right, so that is, I just wanted you guys, because she stated or asked that question. All right, so I'm going to tell your ART number and all of that stuff up there. That, of course, was the dashboard. All right, so let's go back over here. Again, every year when you renew, it asks you, do you have any additional offenses on your record? Once you submit it, so let's say you had a misdemeanor right now. I would encourage you to apply to ART, do the pre-application prior to graduating. That way you know if you're going to be able to sit for your boards. Then once it is time for you to sit for your boards, when you're coming back to apply, you will have already reported that. So at that point, you can say, hey, no, I don't have any new offenses. But after the year passes, the next year, let's say you got a misdemeanor over the process of that year, then you do have to report any new offenses. Once that year passes, if they have stated that you can renew, the following year, if you didn't have any offenses, of course, you don't have to continue to report the old ones, but any new ones, you have to report. And then, of course, depending on what it is, it will go forward to the ethics review and they'll determine whether or not you're going to be able to keep your licensure, if you're going on probation, et cetera, et cetera. Your state licensing goes through here as well. For instance, if you're in the state of Texas, that state test still goes through ARRT. All right, so California, Florida, I know for sure Texas as well has one too. Licensing exams, depending on what it is, it goes through kind of like the testing procedures, whether or not you need or can apply for ADA accommodations, meaning let's say you went through high school and you had an IEP. When you get to college, you can petition to get ADA accommodations. It's called a 504 plan. And sometimes, let's say, some of the ones that are common, additional time for a test, a testing environment that's free of distractions, meaning you're testing by yourself. They can provide some accommodations, but it is up to them which accommodations they will accept. So things like a word bank, that's probably not one that you're going to get, but that is one that they might use like in high school. All right, so that is what's important there. All right, the next thing that is important here is, I don't know if we went over this last week. Here it is. Your competency requirements. All right, these are the requirements that I said I feel are going to be really difficult to get in 10 weeks, especially with you never having touched an x-ray machine in your entire life outside of the simulator. So there's other ones listed here, but we're interested in radiography. All right, from here on this list, we scroll down to clinical competency requirements. All right, it talks about simulated performance. So even though we have a simulator, that is not what they're talking about here. Simulated means that you are in an actual place where there is an X-ray unit and you have an actual patient. So we're going to go through everything with the exception of we're not going to take the actual exposure. So let's say you get to the end of the program. If we had a lab, if there were students missing a couple competencies, we could bring them in and simulate and grade them that way. All right, simulations, you can only have 10, I believe, max, and that's a lot. 10 is a lot, too many, in my opinion. Where's the number? Don't see the number here. Uh-oh, sorry. Oh, right here. The bottom bullet, 10 imaging procedures that can be simulated. That means when you're looking at the list that we're about to look at, there has to be a check mark in the available for simulation box. If this is not big enough for you on your screen, you all can blow it up individually so that you can see it. All right, in terms of the requirements that you need to be able to exit the program, graduate, and sit for your boards, there are 10 mandatory patient care comps, 36 mandatory imaging procedures, so that we're up to 46. Plus, we have 15 electives, but there are 34 that you can choose from, but you have to have 15. And of the 15, 3 are taken. So you must have at least one exam from the head section and at least 2 exams from the fluoro studies section. All right, these are the patient care comps that every student must get. All right, so you have to have CPR. You have to be CPR certified. Most hospitals or in here, we're going to require you to be AHA certified. This is something that you have to pay for on your own. You cannot go to clinic if you don't have it. So you have to do your own research, find an AHA certified course, and you're going to take it. But you don't want to take it too, um, it's only good for 2 years. So you don't want to take it too far in advance. You have to do blood pressure, temperature, pulse, respiration, pulse ox. You have to do sterile and medical aseptic technique, such as sterile gloving, also opening up a sterile tray, etc. You have to do venipuncture. In some cases, that can be simulated. And then you also have to do patient transfer and care of a patient with medical equipment. These are 2 that you need to keep track of. If you're taking care of a patient, meaning doing x-rays, and you had to assist them to get from one point to the other, meaning from the bed to the table, and you use a slider board or you assisted them with a gait belt, this is when you would get your tech to sign off on that. And then also if you're taking care of a patient that has some sort of oxygen tank or tubing, you just take note when you're doing that patient's exams and you get your tech to sign off on that. All right, here's your list of competencies. Again, we might have looked at this briefly before, but it's broken down by category: chest, everything that belongs in the chest category, upper extremities, lower extremities, portables, peds, geriatrics, etc. And then these columns are important. Anything that has a check mark in the mandatory, every student must achieve successfully. And of these electives that have a check mark, you need 15 of them, but 3 are accounted for already. And remember, that's 1 from the head section. Head is kind of not head normally goes to CT these days, so the ones that you might see, maybe a few skulls or facial bones or orbits. Orbits, especially if they're clearing the patient for MRI, they're looking for like metal in their eyes, like metal workers. because you don't want the magnet to snatch it out. The other ones are and sinuses. Sinuses, orbits, maybe a nasal bone, facial bone, skull, but some of these or most of these are really, really, I'll say rare because this type of work now goes to CT. And then, of course, you need two from the fluoro section. Any two that you see, you need to go ahead and get them. Typically, the easier ones are going to be your small bowel series, ERCP, because most of that work is done by the surgeon and you're just taking pictures with the C-arm. HSG, maybe you're assisting the radiologist, but you do have to do the patient education. Upper GIs is common. Barium enemas, I don't, if you see it, you need to probably try to get it, but not a favorite. And then esophagram or swallow, that one's an easier one to get. All right, so again, all mandatories plus 15 from this category. In order to simulate, and you can only have a max of 10, you need to have a check mark in this box right here. If there's no check in the box, then it cannot be simulated. You must get it on an actual patient, meaning it needed to be ordered. All right, and that is what is important from this checklist. All right, some other things that I think are important from here is you kind of have a I'll say a cheat sheet, so to speak. So as you're going through X-ray school and you're going through all of your courses, they give you, I just clicked on the same thing. Not this. A checklist, so to speak. ARRT content specifications. All right, so these are the things that they say, hey, in order to be prepared for your registry, you need to know something about all of this. So it's kind of like an outline, and there are some that are, I think Megan Peretti is a favorite. They sell these outlines. Kettering might be another one. But when you get to your test, there's a total of 200 questions. Now there's a note at the bottom, you may have more than 200 questions. You might have 230. 30 are pilot. You don't know which ones are pilot. They will give you a little bit additional time. So you have to try to answer all of them to the best of your ability. All right, of the 200, the biggest category is procedures. So every procedure that you've ever learned about, 66 questions are tied to procedures. Then you have your patient care section. There's 33 questions there. Safety, so this is rad bio and also physics. There's 50 questions tied to that. And then image production. This is another part of physics as well. 52 questions attached to that. Now here goes your outline. In terms of patient care, so basically everything that is in this book, whether we go over it or whether we don't go over it, you do need to know about it. Also your ethics book that you get to next term. All right, so again, here's your outline. If you take this and you make your own outline and write down the information that you need to know from the book for this, then you're preparing yourself along the way as you're on this 2-year journey. All right, so a lot of patient care information. All right, safety, radiation physics, and rad bio, all of the information from those classes that you need to know. Again, if you're making your outline, each area you research and write down the information that pertains to that as far as how you understand it. All right, so a lot of information in that area. And you'll see charts like this again as you continue in your studies. Image production there. and procedures there. All right, as you can see, it's broken down into what you need to know as far as positioning, what landmarks you need to know, meaning what, let's say if I say iliac crest is a topographic landmark. What body position that they're in, AP versus PA versus supine versus prone versus lateral versus recumbent, etc. If any positioning aids are needed, what the respirations are. Is it stop breathing or suspended respiration? Is it inspiration? Is it expiration? Um, and then also central ray, path of the central ray. Where is there an angle on the tube, etc. All of the anatomy included for that particular image. And then, of course, the evaluation of the structures that you see in the image. All right, and it goes through all of your procedures that you will or can ever see. So everything that will be in a Merrill's book or a Bontrager. Those are the, I'll say, two most popular ones for most schools. And we're going to use the Bontrager. All right, standard terminology for positioning. Again, something that if you took a medical terminology course, you probably are familiar with some of these things. But these are definitions right here. What is a radiographic view versus what a position is versus what a projection is. These two terms, we kind of use them interchangeably, but they are kind of different. Positioning terminology, again, if your positioning book says, hey, your patient is going to be supine, that means that they're going to be laying down and they're going to be on their back. They're going to be prone, laying down on their stomach. Decubitus, laying down on the side, or depending on the type of decubitus, they could be on their back. And then, of course, recumbent, laying down, depending on how you need them laying down. All right, erect or upright, that means they're standing, but they could be seated if we can't get them to stand. And then also all of these other, I'll say more advanced terms. So left anterior oblique versus right anterior oblique. What does that look like when it's asking for that in a book? Rotations, internal versus external, and whether it's medial versus lateral. So these are the pictures that are associated with that. So the first picture on the left, when we say, hey, we're going to do an AP projection, that means that that patient, when the X-ray beam is leaving the tube, it will enter their front or their anterior portion of their body, and it will exit the rear or their back, the posterior projection of their body. So if I say I need an AP chest, that means that the patient is going to be facing you versus facing the X-ray board. All right, PA projection, entering their back or posterior and then exiting the front, the anterior. All right, same thing, right lateral. All right, they are sideways and the beam is entering their side and exiting the right side is the closest to the board. Left lateral, left side is closest to the board. All right, obliques, depending on which one it is, we can have anteriors and we can have posteriors. When we say left posterior, that means that their posterior side or the back side is closest to the board, but the left side is touching or closest. So the back is closest, but the left side of their back is closest. Same thing here. The back is closest, but the right side is touching because they're oblique. Same thing for the anteriors. All right, so again, this is your cheat sheet for the 2 years that you're in school. If you print this out and start filling it in as you go, it's a little bit better for you to grab it when you're studying at the end. All right, the last thing that I want to go over with you really quickly before we end class is ASRT. All right, you can join this as a student. You can join this as a technologist once you graduate. It does provide us with continuing education opportunities, as you can see here. Also, these directed readings, this is like the book that they would send you, but it can be done online as well. You're going to read through a section, you're going to answer questions, submit your answers, and they'll give you CEUs for those. They also have annual conferences as well. And if you're getting your CEUs through them, they can track them for you as you finish. All right, there is a cost associated with membership. All right, it tells you about the benefits, join or renew. All right, as you can see, it's not cheap, but it is worth it if you're actually using it because it does give you discounted prices on some things. So you can buy now a 1 year, 2 year, or 3 year membership. And I feel like now they have a way that you can pay for it like incrementally. Like you don't have to give them the whole 125 all at one time. Where is the student? All right, I don't think I'm an active member right this second because I don't need it. But if I wanted to go in and pay, I think this is where you would ask. Oh, this is just telling me my stuff. This is where it would tell you the price for yourself. And of course, the student membership is a lot cheaper. All right, but what I really brung you here for is so that you can see your state licensing information. All right, it says ASRT states that regulate, and all of the states come up, but not all of the states have a requirement. So here's your definitions. What is licensure? All right, they define it as a license, a certificate, or a permit, depending on the category you're looking for. What does it mean to be licensed? That means that usually there's some sort of credential that says that you have the proper education and training to have the licensure. And some states have equipment regulations. So that's also in here, meaning in order to operate that x-ray machine, that x-ray unit or the facility, someone came and checked it out and it is properly functioned and you can work with that equipment. All right, so I'm going to show you Georgia first, and we can chime in and look at a couple other states that you all live in. All right, so as you can see, I click on Georgia. In terms of, is there a licensure requirement? As you can see, it is blank there. So for radiography, so that is a no. Since it says blank for radiography, that means that they don't have a licensing body for the rest of these. But I can say for sure that to get a job in all of these other ones, with the exception of radiography, you pretty much need to have your ARRT. All right, even though there's not a state requirement, you need to have your ARRT. All right, so we're really only interested in the licensure section, but there are equipment requirements in some states and also standards in some states. So if there was a requirement for me to be licensed, I would go to the website for the credentialing or licensing body, which in Georgia, it is this link. All right, it hyperlinks you to the entity or organization, and that is where you can find the application, you can find the fees, you can find, what is needed in order to get the licensure. And as you can see right here, it's not just X-ray, there are some other things that have a licensure requirement, such as the Board of Pharmacy, the Board of Dentistry, etc. All right, so that is the state of Georgia. So what other states do we have here in the class? And you're gonna have to turn on your mic because I'm not looking at your picture. So if you want to look at it,
Michigan,
New Mexico?
Michigan.
Oh, Michigan. All right, so we find Michigan. All right, and it says that there's no licensure requirement for Michigan per the website for this. But there is an equipment licensure, but we're gonna go anyway to Michigan. All right, this is their board that regulates. And it looks like you have to sign up for an account, but it looks like right here, the only thing that they're licensing right here in this particular state is mammo equipment. Of course, to operate an X-ray room, they need to see a shielding plan, and all X-ray machines and facilities need to be licensed. So I feel like that's the same for Georgia as well. So shielding plans, mammal topics, plural topics. So it does not look like Michigan has a licensing requirement to work in X-ray.
Thank you.
Mm-hmm.
Can we look at Texas, please?
All right, we'll look at Texas. But in all cases, though, you do want to, I would say, look at a job announcement. And then you can also contact this entity to say, hey, I just graduated X-ray school. I do or do not have my ARRT. I would like to work in the state. How can I do it? Or look at a job announcement to see. All right, Texas, I know for sure because I lived there. They do have a licensing requirement. All right, so find Texas. All right, and as you can see, for X-ray, you need a state licensure. Also for nuclear medicine, interventional, radiation therapy, limited technologists, meaning you went to some type of X-ray school, but it was limited in type. So there's some exams that you can't perform, but you need a licensure for that to work in the state. And RA, you need a licensure for that. Now, if these radiography, you need a licensure. Doesn't necessarily say you need the licensure for CT, but to work in CT, you will have had this one first, anyways. All right, so we'll go to the state board. Hopefully, it doesn't have you make an account. All right, just like ART, you can look at the licensure, apply and renew. And we want other, oh no, here it is, medical radiologic technologist. Right here, you can apply, you can click apply, but let's just look at, well, let us look at questions. Can't look at questions. All right, let's go to what you all are here for. You want to be just the general and temporary, because we're not looking for limited and we're not looking for the limited exam. All right, before you apply, it says what? Make sure you review the documents. All right, so there's a document checklist that you need. And then here's a sample application for you. So on the application, let's see. All right, the ways that you can pay. Ask about your information, ID. Do you have credentials already? So are you certified by a national organization such as the ART, yes or no? List the organization and your ID number associated with and the type of certification you have and the issue date. And you just go through and fill out your application. Let's see if there's a fee here. All right, check which ones you want. So for you all, it would be general certificate. See, hold on, applicant holds it separately, national. No, not that one. Then maybe temporary general. You may need to you may need to call and get assistance with your application, but I know it's not limited because I mean, I know you don't want the limited one, or you can if you want to, but they don't get to do all of the exams as a limited tech. All right, again, just like ART, it asks you about your criminal history, your background. Once you do it once, if you don't get any more offenses, you don't have to keep reporting the offenses that you've reported and that they've cleared. And it tells you how to answer these questions. All right, mental and physical health, just like our checklist, it asks about that. And then your attestation saying that you know you're making true statements. So this is just your sample one, but you can always, if you're having trouble filling out your application, you can always call or email, etc. All right, any more states?
Quick question on that. With the if with travel assignments, do you know like how long it typically takes to get each of these licenses per state?
I don't know how long it takes, but I do know that if you will not be able to work in that state until you have your state licensure, if there's a requirement. But the travel agencies, they're well versed in it, so they can probably answer that question a little bit better because they work with people all the time that are, jumping from state to state for jobs.
Thank you.
Any more questions or
Can we,
state?
can we take a look at Pennsylvania? Please?
Maryland,
Thank you.
Who? Did
Maryland.
you? Maryland, Maryland does have a state licensure. In fact, at one point in time, Maryland would not allow you to be licensed if you were not a graduate from a JCert accredited program. But now they've redlined through that. Maybe there's a shortage, and they do allow it. So let's quickly look at Pennsylvania. You did say Pennsylvania, right?
Yes.
Up north. So it doesn't look like there's a licensure requirement per this. Again, I would definitely look at job announcements as well. But we're going to go to their website. All right, this is who you would apply to if there was a requirement, X-ray machine program. Let's see. Any individual operates X-ray machines shall be instructed adequately. The department, blah, blah, blah. Refresher training. So it looks like the only thing that they may like do here is, again, in some of the states that don't have a licensure requirement. So even though Georgia does not have a licensing requirement, it does require that we are well versed in radiation protection. So that is a certificate that you must show your employer. So the department shall provide a list of professional organizations and resources whose registry training and tests may be used as proof of compliance with initial and continuing education requirements. So it doesn't look like there is a state licensure here. But this one I would definitely do more research and call about, even though it says there's not one. This is for equipment. This is also for equipment. This looks like more so equipment needs to be licensed or registered. Let's see. All right, so I would do a little bit deeper research. You may need to call them. Doesn't look like there's a licensure requirement, but I would call them and I would also look at job announcements in your state. All right,
Okay,
the last
thank
one,
you.
before I need to jump off. Go ahead. Go ahead and someone was talking. I said Maryland.
Oh, I just was saying thank you.
hmm So let's look at Maryland real quick, and I'll just show you what I was talking about. They do have a licensure requirement, so you must have their state licensure to work there. This is the website. So we're gonna find X-ray radiographers. What's the requirement? All right, 18, graduate. From now it states from a radiography program that is recognized by ARRT. This wording used to say, see it right here at the bottom, effective October 21st of 2024, they no longer require that program to be J-Cert accredited. It's still pending, so it's red line, but right now you just have to be a graduate from a program that's recognized by ART. So if you see right here, all of that stuff has been red line when they're talking about J-Cert accredited program. All right, last thing, how do you know if your program is recognized by ARRT? I guess that's the one thing that I missed. Um,
I called the ARRT to make sure American National University was affiliated with ARRT. That's how I found out.
all right, so here you can go to their website. It says verified educational programs. You will click on it, just like J-Cert. It gives you, you can search by state, you can search by college name. So select a discipline. We're interested in radiography. All right, and then we're gonna filter because we don't want to go through all this list. So we'll filter, um, you can filter by state too if you wanted to. All right, and as you can see, your college is listed there, American National University. Pikeville is where the campus is located. So again, very important as you're picking programs that you want to go to, that you do your research, figure out if the end result is going to allow you to reach the goal that you want, which is to be eligible to sit for your boards with the ARRT. All right, so last thing for your ICA, finish up with your notes, meaning we went over these things. So briefly tell me what you got from going through these websites, and then you're gonna load that immediately following class. All right, any more questions for me? I got 1 minute for you. Uh-oh, looks like there's some stuff in the chat.
Do you want us to upload the second part of the notes in the same
Yes,
assignment? Okay.
yes, in the same assignment.
So
So I'm sorry I didn't get to Ohio and Kentucky and Missouri. I didn't see these in the chat, but just go to ASRT, look at state or Google like state certifications. You click on your state, you're looking for it in the licensure portion. If they have something listed there, then you go to the website, look for the application, and then also look at a job announcement for your state. They do a pretty good job telling you what you need as far as to get a job or get that job in that state. All right, so I will see you next week. I got to get to the next class.
And real quick, do we just do it in a second attempt, or do we?
Yes, ma'am. Yes,
Okay.
ma'am.
Okay,
Just a
thank you.
second. Mm-hmm.
Thank you.
All right, thank you.
Have a good weekend.
You too.
Yes.
Have a good holiday.
So.